Having mastered the arts of anatomy, physiology and biochemistry, or at least somehow passed the exams, we moved on to the clinical course, which, in contrast to the preclinical course, teaches you about diseases and their treatment. That is, what most people would consider as medicine. One might wonder why it is necessary to spend 3 years learning about how the body functions normally, and that would probably be a fair thought. You could argue that you could pick it up along the way whilst doing clinical medicine on the grounds that the normal function is what is not going on when disease is present. Probably not quite true, but it's a good thought. Apart from lectures and seminars and the occasional resort to a book, most of the clinical learning took place by traipsing around after the doctors on either working or specialised teaching ward rounds. The difference is that the teaching rounds were devoted entirely to the students, unlike the working rounds where the patients also got a look in. They don't make consultants now like they did 30 or 40 years ago. Consultants in general can be broadly divided into two groups according to speciality: surgeons and physicians. Surgeons operate, but physicians treat by non-surgical means, usually drugs, conditions such as epilepsy, diabetes, pneumonia, and heart failure. There is mostly good-natured rivalry between them. Surgeons believe that they can do everything a physician can do and operate as well. Physicians believe that they do all the important work before and after an operation, and surgeons are all right as long as they just cut along the dotted line. It has also been said that the difference between a surgeon and a physician is that a surgeon is someone who has no confidence in nature's powers of healing before the operation, but every confidence afterwards. Rodney Potts was a fairly typical surgeon from the old days. His manner was as smooth as high-quality motor oil, his voice was deep and resonating, and his complexion permanently tanned, and all the more noticeable because of the contrast with his milk-white hair. Someone told us that his permanent tan came from his passion for sailing. But if so, given its permanence, it makes you wonder how he managed to fit in any operations. Mr. Potts was a vascular surgeon, that is, someone who operates on blood vessels. His stock in trade was varicose veins, which together with his appearance and demeanour made him the ladies' darling. The business of the ward round was punctuated by frequent effusive thank you speeches from his patients, exceeded in frequency and intensity only by an Oscar ceremony. John Jack, also a surgeon, had a presence that was as difficult to ignore as that of Mr. Potts, but he chose quite a different way to express it. Mr. Jack was tall and thin, almost to the point of being gangly. On ward rounds, he made a habit of holding forth to anyone who would listen on subjects that included not only medical matters, but also ranged through politics, music, work-life balance, and the key defining features of hospital administrators. As he gave these soliloquies, he would adopt a series of demonstrative poses, often leaning with his weight on one leg, with the other held at an angle slightly behind him and resting on his toes. His arms would be held out slightly to the side of the body, or one arm would rest vertically by his side, and the other would adopt a posture as if pointing to the sky. He looked as if he was a crane fly performing Swan Lake. John Jack was a general surgeon. That is, he undertook most forms of surgery. Indeed, he was wildly opposed to the increasing trend of super-specialisation. "Not much bloody good," he said, "if you're on board ship. Somebody breaks a leg and you say, 'Sorry, I only know about the bladder.'" It seemed as if the physicians were generally quieter and less impulsive, although I may have been developing increasing bias. Samuel Bywater certainly exemplified the distinction from surgeons. He was rotund of both face and body, sported a thick walrus moustache, and smoked 20 Benson & Henson cigarettes per day. His working hours seemed different from any other consultant. In the morning he stayed at home and worked in his garden, arriving at the hospital about lunchtime. He fitted in a lot more work than the average consultant, which was considerable, by staying at the hospital late into the day and even night. A particular habit of his was to take a break in the late evening to recharge his thoughts, and he would typically go for a walk in the streets around the hospital. On one occasion he stared upwards in order to gain inspiration, but unfortunately was outside the residential block of Somerville College, a ladies' college at the time. A helpful policeman arrested him for voyeurism. The claim that he was a consultant physician at the Radcliffe Infirmary met with a derisive laugh. Yes, and I am the chief constable, and accompanied transport to the local police station. His research fellow became his guardian angel by going to the station and confirming his identity. If only Dr. Bywater had altered his appearance to be more like that of surgeons and had stopped wearing a grubby mac to walk around town, events may have taken quite a different turn. Clinical school, the consultants, the patients, the beer, and oh yes, the nurses. Being a teaching hospital, our hospital had not only a clinical medical school, but also a nursing school, again situated in the hospital grounds. Every year, a new cohort of 18-year-old girls would arrive at the nursing school, where they would spend the next 3 years, mostly in residence. By the way, all the nurses in those days, at least in our city, were female. This may have been a deliberate selection ploy by the authorities, so that they did not have to build a separate residence block for men, who knows. There's something stirring about having a residential block of young and not so innocent girls just yards away from the clinical school. It seemed to me that as a breed, nurses were remarkably attractive, but I may have been looking through sex-coloured glasses. It certainly seemed easier to have a casual relationship with a nurse than a medical student, because the chances were that you would not have to spend the next day working closely with them. Access to the nurses' block was along a straight corridor from the main hospital, up a flight of about 6 steps, followed by a 180-degree turn to the left, and then a further climb up another 6 steps to the first floor. The nurses' rooms flanked the upstairs corridor, with an appearance similar to a 1-star hotel. At the entrance to the block on the ground floor, before the first flight of stairs, was an office with a sliding glass door that opened onto the corridor on the left side. This office was manned, or actually womaned, by a ferocious gauleiter who vetted every person who sought to gain access to the nurses' inner sanctuary. You practically had to have a passport to get in, and if you were male, there was little chance, unless you could prove that you had come to repair the heating system. Against this impediment, ingenuity had to prevail. The accepted way of overcoming the hospital equivalent of the Berlin Wall was to start a gentle run down the hospital corridor and accelerate on entering the corridor that led to the nurses' block, so that peak velocity was reached just before the guardian's office. At this point, a well-directed leap would gain a position on the first step of the staircase. Safety was reached on turning the corner in the staircase just a moment later. The technique did incorporate a small gamble that Mother Hen would not be staring straight out through the glass window at the time of the flypast, but if the moves were executed to perfection, the passing image would have been so transient as to create uncertainty whether she had seen anything or not. Of course, by the time she got out of the office to check, the illegal immigrant had merged into the fabric of the building, specifically one of the nurses' rooms. It was wise only to use this procedure to visit a girlfriend, because unsolicited visits would run the risk of police arrest. Nurses did not remain sweet and attractive as they got older and gained more senior posts. Well, not all of them anyway. The sister on Robert Downing ward acted as if she owned the ward, and come to think of it, I have no way of knowing that she didn't. She ruled it with the compassion of a prison guard, at least as far as non-patients were concerned. She particularly hated students. Indeed, we were not allowed onto the ward without asking her specific permission first. If she were absent from the ward when we wanted to visit a patient there, we would have to wait politely in the waiting room until her return. In truth, I don't think that she ever left the ward, but employed the waiting game as a tactic to exert her dominance. Attempts to enter the ward without her permission were universally pointless, because she had such a refined form of student detection apparatus that she could identify our presence within seconds of entering, even if she were engaged in some other task at the time. Rarely would we get more than a few yards down the ward before being halted by a bellowing "Student!" boomed out from the dragon, standing, legs apart and arms akimbo at the end of the ward, with her flushed face jutting forwards from the neck. We did not know her real name, but she was known as Sister Robert Downing after the ward.